Now, all of these risks mean that extremely high levels of safety and security protection must be applied, and that work with dangerous pathogens must be conducted responsibly. This is especially important for work with pathogens that may have devastating consequences for local, regional, and global communities if exposure or accidental release were to occur. Maximum containment laboratories, commonly referred to as biosafety level 4 labs, are designed and built to work safely and securely with the most dangerous bacteria and viruses. There is, however, currently no requirement to report these facilities internationally, and no international entity is mandated to collect such information and provide oversight at a global level. There are also no binding international standards for safe, secure, and responsible work on pathogens in maximum containment labs. So in response to this gap, our study has developed this interactive web-based map of global biosafety level 4 facilities and biorisk management policies. The map identifies BSL-4 labs that are planned, under construction, or in operation around the world. We've used the WHO Lab Biosafety Manual definition of maximum containment. We are, of course, conscious that there are variations in national biosafety specifications, but in general, we take BSL-4 labs as designed to work with risk group 4 pathogens that can cause serious disease and be readily transmitted from one individual to another, and for which effective treatment and preventive measures are not usually available. We restricted the scope of our study to labs working on pathogens that can affect humans, including zoonotic diseases. So that meant that labs that only work on pathogens causing diseases in animals were excluded, and we also excluded mobile BSL-4 labs. On the map, and you'll get a demonstration in a minute, but when you click onto the individual labs, you will find a brief characterization of the lab, as well as indicators of good biosafety and biosecurity practices in the countries where the labs are located. Our study and our findings have all been written up in this policy brief, which will be available on the globalbiolabs.org website. So you can go through the material at home in your own time. So at this point, I would like to introduce you to the rest of the team. Dr. Greg Koblenz has been my co-lead on the project. Greg is an associate professor at George Mason University in the United States, and he serves as the director of the Biodefense Graduate Program at the George Mason Schar School of Policy and Government. Joseph Rogers is a PhD student in the Biodefense Program at George Mason. He is also linked to the Center for Strategic and International Studies, where he acts as a program manager on their project on nuclear issues. You'll hear from both Greg and Joseph shortly. I also wanted to give a shout out to Min Lee, who is nearly ready to graduate with a master's in biodefense from George Mason, and who has provided absolute stellar research support for our project. So thank you, Min. I'll now turn over to Greg to take us through the study and some of the key messages that are coming out of the study before I then turn over to Joseph, who will provide a demonstration of the map. So with that, over to you, Greg.
Thank you, Philippa. So this is, as far as we know, the most comprehensive assessment of the number of BSL-4 labs around the world. Our research identified nearly 60 BSL-4 labs in operation, under construction, or planned. And as you can see here, the greatest concentration of these labs is in Europe with 25 labs, followed by North America with 14, Asia with 13, Australia with 4, and Africa with 3 labs. Given recent concerns about biosafety, it's worth noting that more than 3/4 of these labs are located in urban areas. The number of BSL-4 labs around the world has also been growing steadily. For the 42 labs for which we have dates on when they were established, half became operational in the past 10 years. We expect more countries to seek these types of labs in wake of COVID as part of a renewed emphasis on pandemic preparedness and response. And this is a big part of the reason why we thought it was important to undertake this study now in order to identify gaps in national, international biorisk management standards and with the hope of strengthening those standards as more of these labs become operational and work with dangerous pathogens. Later in this presentation, Joseph will give you a tour of our interactive website with the map of the locations of these labs and provide some basic information about them. But before we do that, let me highlight a few key takeaways about these labs. If you go to the next slide, please. So first, most of these labs, about 60%, are government-run public health research institutions. An equal number of these labs, about 20% each, are run by either universities or by biodefense agencies. These labs are used either to diagnose infections with highly lethal and transmissible pathogens, or used to conduct research on such pathogens in order to develop new medical countermeasures or diagnostic tests, or improve our scientific understanding of how these pathogens work. 80% of these BSL-4 labs focus on human health, while 11% focus on animal health. The rest work on both animal and human health outcomes. Virtually all of the pathogens that are studied in these maximum containment labs are zoonotic, meaning that they can cause illness in both humans and animals. So the differences between these labs is less the type of pathogen being studied and more in the population that the lab is seeking to protect. And also, just to reiterate a point that Felipe made earlier, our study did not include any labs that work only with pathogens that affect only animals. If you go to the next slide, please. While large BSL-4 labs get most of the attention from policymakers and the media, the reality is that most BSL-4 labs are relatively small. Of the 44 labs that we have data on, half are under 200 square meters in size. That's less than half the size of a professional basketball court, or about 3/4 the size of a tennis court. And that lab size might include auxiliary spaces and equipment like chemical showers, animal rooms, and autoclaves, in addition to the hot zone where work with a live agent is actually conducted. 1/4 of the BSL-4 labs have more than 1,000 square meters of lab space, and the rest are somewhere in the middle. If you go to the next slide, please. One very interesting and sobering finding from our research was that only about 1/4 of countries with BSL-4 labs received high scores for biosafety and biosecurity as measured by the Nuclear Threat Initiative's Global Health Security Index. The Global Health Security Index measures whether countries have legislation, regulations, policy, oversight agencies, and training on biosafety and biosecurity. Also, only 40% of these countries that have maximum containment labs are members of the International Experts Group on Biosafety and Biosecurity Regulators, which is a forum for national regulatory authorities to share best practices in biosafety and biosecurity. Furthermore, none of the maximum biocontainment labs that we identified have yet signed up for the Voluntary International Standard for Biorisk Management, known as ISO 35001. This means there's a lot of room for improvement for countries and labs to develop comprehensive systems for biorisk management. In terms of transparency, the good news is that all countries that have signed the Biological Weapons Convention have declared their BSL-4 labs under the treaty's confidence-building measures. However, only 9 countries have made their declarations public. The labs themselves could also be more transparent. Only half of these labs provide a list of publications on their website. In addition, all countries that are required to report on their legislation to prevent the misuse of biology and biotechnology by non-state actors under UN Security Council Resolution 1540 have done so. And most have scored pretty highly in terms of the completeness of their legislation for that purpose. If you go to the next slide, please. Finally, only 3 of the 23 countries with BSL-4 labs have national policies that provide oversight of dual-use research, which is research that is conducted for peaceful scientific purposes, but could be misused. One type of dual-use research is called gain-of-function research, which involves intentionally modifying a pathogen to give it new characteristics, such as enhanced lethality or transmissibility. This is a public health version of red teaming, trying to predict what an adversary can do in order to develop better defenses. In this case, however, the adversary is Mother Nature. Researchers can use this information to identify which viruses pose a higher risk of jumping from animals to humans or becoming transmissible between humans, develop new vaccines and therapeutics, or improve surveillance systems. But in the process, researchers are developing potential pandemic pathogens that could pose biosafety or biosecurity concerns. Our findings indicate that the vast majority of countries with maximum containment labs do not regulate gain-of-function research. Since gain-of-function research is expected to increase as governments and labs seek to identify future pandemic risks, this gap in national and international oversight is worrisome. It should also be noted that dual-use research and gain-of-function research can also be conducted in labs with lower levels of biosafety, and these labs should also be subject to such oversight. Also, just to be clear, we are not saying that all BSL-4 labs engage engage in gain-of-function research. But we are noting a disconnect between countries with most advanced biomedical research capabilities and the lack of sufficient safeguards to ensure that such capabilities are being used safely, securely, and responsibly. So with that summary of our policy brief, I want to turn this over to Joseph Rogers, who will provide you with a demonstration of our interactive website.
All right, so I'm going to talk you all through how to navigate our website, how to access our policy brief, how to get to the map and how to use the map, and then finally describe some of the resources methodology that we used. So starting with how to sort of navigate the overall website, when you land on globalbiolabs.org at the end of this event, the website will be live and you'll end up on this sort of homepage. From this homepage, you can access our policy brief and the map from the navigation bar, or just go down a little bit and you'll see the links to the brief or the map. When you click on the policy brief, it'll take you to this page where you can download the brief by either downloading from report or clicking on the image. But everyone's here for the map. So when you get to the homepage, you can click the map or hit view map, and it will take you to this page. And this page is sort of the overall map of all 59 maximum biocontainment facilities that we've identified. And I'm going to walk through 3 brief examples of different labs to give you a sort of flavor of the diversity of labs that we looked at here. So the first lab I want to look at is in Australia. And you'll notice that in the map here, when you click on Australia, there's 4 labs. And it brings you to this page with all 4 labs. As you kind of hover over them, it'll show their locations. But when you zoom out, you'll only see the 4 labs in Australia, and that's because you've selected Australia only. So if you sort of get lost in the map and you only see 4 labs and not 59, then you need to sort of click back over here. So going back to Australia, when you get to Australia, we're going to look specifically at the Center for Disease Preparedness, which is this lab here. So when we click on the lab from the drop-down menu, you'll see that we have the location of the lab. We've included a photo where available of the lab and some information pertaining to the lab on the left-hand column here. So we have 2 sort of overarching types of information on this left-hand column. We have information about the lab itself and information about that country's sort of biorisk, biosafety measures that you'll see. So I'm going to talk through this example in a little bit more detail. So the Australian Center for Disease Preparedness, you'll see that we have the address, or in some cases, the latitude and longitude of the lab right here. We have the institutional affiliation, which is most often a government agency, but not always. We have a link to the website and a link to publications, which, as Greg mentioned, only about half of the labs have links to publications. So that's one of our sort of best practices measure. We have the type of lab listed here. This lab happens to be a public health lab, but we have 4 categories: public health, defense, private, and university. And the 3 labs will all be different types of labs that I'll talk about briefly. We have the date the BSL-4 was established. We have the status, the size of the BSL-4 lab, and most of these came from the BWC confidence building measures. We have the lab's ISO 35001 status. Currently, none of the labs have ISO 35001s, but that's hopefully a best practice that we will make progress on. And then after that, all of the information that is in the bottom of this pertains to the sort of national biosafety, biosecurity measures. So we have the national biosafety associations or international biosafety associations, whether they belong to one, the national IEGBBR membership, whether the country has dual use policies, the Global Health Security Index, biosafety and biosecurity rankings, which we've kind of made into high, medium, and low, and a link which you can copy and paste from the map here to the BWC CPMs. So that's the Australian Center for Disease Preparedness, but I'd like to sort of walk you through now a different lab in another continent. So you'll see when we go all the way back to the homepage of the map, we are going to go to Europe. We're going to look at a Czech lab, but I'd like to note that sort of in the Europe column, we've identified all of Russia as being in Europe, so just categorically something to note. So going down, we're going to look at the Department of Biological Defense Military Institute of Health in the Czech Republic. You'll notice in this lab that unlike the other lab, this lab is a defense lab. So the type of lab is defense as opposed to public health. You'll see kind of the same information, the address, the institutional affiliation, and the data about the labs, as well as the country's sort of national biosecurity metrics down there. And you'll notice that this lab doesn't actually have links to publications. But other than that, they provide sort of pretty good transparency, I guess. You know, there's the website and everything else. So that entry is somewhat pretty well filled out. So we're going to go back to the last lab that I'd like to look at, and that's going to be in Asia. So we're going to take a look at a university lab to conclude, and we're going to look at the Nagasaki University BSL-4. You'll see that when you load this lab up, it pulls up the sort of satellite image. We don't have a photo of this lab. However, you'll see the sort of standard information that I've previously described. You'll see that it's a university lab and all of the links to the information. So that's kind of how to operate the map. I'd like to talk about how we gathered some of the data for this map. And that's something that's on the web page as well. So when you end up on the home page, you can go over to our resources tab, and that will take you to this page, which we've provided some of the key sources of information. This is certainly not all of the sources of information that we gathered our labs from, but these are the sort of really big takeaway key sources. So you'll notice that the first one we have here is the BWC CBMs. So Min was very diligent about data mining all of the BWC CBMs that were public, and we gathered the vast majority of the labs that we've identified through the BWC CBMs, but not all of the information that we've gathered was there. So we went to other sources. You'll see that we have the 1540 reports. We looked at the World Health Report, World Health Organization report from 2017 that has a list of BSL-4s in it. We also looked at the JEE reports and some academic publications that we've linked to one here, which is a report that also has another BSL-4 list. So in addition to looking at these sort of international reports and academic reports, we also looked at news articles and gathered, information about when the labs went operational, what the construction plans are, and things like that. And after we've sort of amalgamated all of this information, got our sort of universe of labs, we sent this out to the labs themselves and asked them to verify the information. We also sent this out to other experts and got their feedback. And so, that's sort of overarching our methodology here. The last thing I'd like to conclude on is that if you are going through the map and you notice any information that you feel is missing, or you have, any information that you think would be relevant, then please let us know. And you can contact us at globalbiolabsproject@gmail.com, which is an email address that's listed on all of the web pages. So it's on the bottom of every web page on the globalbiolabs.org site. So I will make this site live once the webinar ends, and hopefully we'll get some. Hopefully you'll all come visit. So I'm going to turn it back over to Felipe now.
Thanks very much for that. I'm going to finish up on key recommendations. We have 5 key recommendations to address biosafety and biosecurity risks, as well as risks to peace and international security. And the first is that BSL-4 labs must continually work to cultivate a culture of biosafety, biosecurity, and responsible research with high-risk pathogens at all levels in that institution. So from the student level through principal investigators to lab directors. And developing this kind of culture is not a one-off event. The second recommendation we have is that BSL-4 labs must not only adhere to national laws and regulations on biorisk management, but also implement and share best practices, participate in peer reviews, and strive to and adopt international standards such as the ISO 35001 on biorisk management for labs and other related organizations. Third, all countries, but particularly countries where high-risk pathogens work is carried out, must ensure that comprehensive risk assessments are conducted for dual-use activities with significant potential to be repurposed to cause harm. We also recommend that internationally recognized guidelines governing this kind of dual-use work must be developed. Fourth, countries possessing BSL-4 facilities must provide complete, regular, and transparent reporting under the annual confidence building measures of the Biological Weapons Convention and under the UN Security Resolution 1540. And countries that make these publicly available are, of course, engendering greater confidence than if they keep them private. And finally, we recommend that international and national structures be put in place to systematically register and oversee maximum containment facilities. We will shortly go into the Q&A, so please do start entering questions into the Q&A functions. Please do use the Q&A function rather than the chat. Before we start though, I wanted to highlight some of the challenges to our study, because it might seem relatively straightforward just to map a bunch of labs, but it was actually anything but. I will highlight 2 challenges in particular. We list a couple of more in the policy brief. The first is that there is no single definition of what constitutes a maximum containment lab. There are biosafety level 4 labs and biosafety level 3 labs, but there are also BSL-3 plus labs. And some refer to BSL-4 enhanced labs. Some BSL-4 labs are suite labs, some have BSL-4 glove boxes. There are CL4 AG labs, so these are containment level 4 agriculture labs, and there are ABSL-4 labs. These are agriculture biosafety level 4 labs. And ABSL-4 lab is not necessarily the same as a BSL-4 AG lab. So physical containment measures vary across countries, as do biosafety and biosecurity practices. All of this means that identifying them becomes more of an art than a science. A second challenge is characterizing when a lab is actually established. Again, it doesn't sound a difficult thing to do. What we've tried to do is to supply dates for when labs were announced and planned, dates for when they were when construction was complete, and when work actually started. But these figures are hard to come by, so our data set is by no means complete on this. And similarly, it's challenging to characterize the size of a BSL-4 lab. The numbers will vary depending on whether lab space is tightly defined as the space where work is actually conducted, or whether it is more broadly defined to also include supporting infrastructures such as chemical showers, animal cubicles, utility rooms, and so on. We've gone with the broader definition, though we are not always sure on the numbers whether they are the tighter or the broader definition. The final point for me is that our map and data set is, as Joseph said, still a work in progress. So we do invite you and enthusiastically encourage you to submit information about labs and biorisk management practices that you know about to us, so that we can improve the resource and further efforts to strengthen national and international biorisk management. So that is all from us in terms of the formal presentation that we had prepared for you. Over to Greg for initial questions.
Thanks, Felipa, and a lot of really good questions been posed so far. Some of them relate to questions about the kind of the mapping exercise and the BSL-4 labs themselves, and some about the biorisk management policies that have been developed or are being considered. So I guess I maybe first tackle a couple of questions related to the BSL-4 labs and how we did the study. There's questions about whether or not we considered whether labs have glove boxes or have full suits. And as Felipa mentioned, we didn't differentiate within the listing of the labs. So labs that use either type of containment for maximum containment were included. We hope to have future versions of this project that will have more granular details about the both the policies and practices of these labs. So that's something that we'll get into in the future. There's also a question about why we didn't include BSL-4 labs that handle pathogens affecting animals. And in part, that's because there's a separate set of biosafety standards that deal with animal pathogens, and those are promulgated by OIE. And there's even less consensus on the level of biosafety needed for maximum containment labs working with animal-only pathogens. And so we wanted to stay focused on just the labs that work on pathogens that can affect human health. But again, expanding to looking at animal-only labs, animal disease-only labs is something that we definitely want to consider in the future. And it also just highlights the degree to which there's a lot of differences both between countries about how they define biosafety, and then kind of the lack of a really clear standard at the international level that all countries have agreed to.
So there's a question about whether the labs are aware that we've published this information and what type of awareness we provided. So yes, absolutely. We did try to contact all the labs, or we emailed all the labs that were that are listed on here to let them know that this was about our project, and to give them the information we currently had on them. We asked them to verify the information we held, to complete any information that we didn't have at the moment. A small number of labs replied. We had more than a dozen replies, but more than a dozen out of almost 60 it could be improved, right? So the labs were informed, but hopefully this is the start of a dialogue, and we're also hoping that by publishing this sort of data, these labs will start paying more attention to how their activities are perceived. There's a second question on asking whether the WHO or the Biological Weapons Convention is the better institution to fill the loophole of lab management. I think from my own perspective, I think neither institution as it's currently configured is set up to do this kind of work. You could see how both kinds of institutions could potentially do them. I think a more natural fit would be with the WHO, but the WHO currently doesn't have this kind of mandate. So some sort of restructuring would certainly need to happen, or a remandating, a specific tasking if this was going to happen. Greg, over to you.
And one of the related questions we have is about the use of the ISO 35001 standard, which is not a public document. It costs about $100 to download it. And the question is, is that something that's appropriate? The reality is that these BSL-4 labs cost, many millions of dollars to construct. So the cost of $100 to download this international standard for biorisk management practices should not be a barrier to labs that are operating in this space. And one of the real advantages of this standard is that, it was developed by an international group of experts, so it doesn't just reflect any one country's views on biosafety and biosecurity. And it really provides a kind of comprehensive system that labs can use that doesn't tell them, what biosafety measures to have or what biosecurity measures to have, but having a process to ensure that the safety and security measures they have in place are commensurate with the risk of the pathogens and the types of research that they're doing, and that there is a management system led by the leadership of the organization that includes the PIs and all the staff there to make sure that everyone is working towards the same direction and maximizing safety and security. Having that system in place means that these labs would also have a paper trail of their procedures, their practices, and then in the event of any kind of accident or incident, they would have a very clear record of what they're working on and how they're doing it that they could use to inform authorities about any concerns there might be. So we see this standard as being very valuable. It did only come out in December of, I think, 2019, so it is very recent, and obviously all of the maximum containment labs that we were looking at, many of them are highly engaged with working and responding to COVID-19, but we hope that once the demands of the pandemic have been reduced some, they'll be able to adopt that standard and make that a widely adopted standard that all labs will be implementing.
I guess I would follow up just briefly on that, because there are a number of questions related to finance. One actually touches very nicely on your question, Greg. It says, do you have any comment about the use of a non-open paid ISO specification for the standard rather than something publicly accessible? So yes, the ISO standard is expensive. There isn't at the moment an equivalent free standard. There are, of course, other standard organizations internationally, but at the moment there really isn't others. So it's not that we are trying to promote an expensive product, but it's really about seeing what is currently available. Another question was, do you intend to address issues of the costs or sustainability of such facilities, especially in lower resource settings? I think this is also important to draw attention to, that it's very expensive to build these kinds of facilities, but I think in the long run, it's even more expensive to sustain them. And that is an important factor that needs to be made clear in when a country decides to build this kind of facility. We are, as you saw from our findings, seeing an increased number of these facilities established worldwide. And certainly this sustained funding needs to be part of that equation. A final question or a final answer from me on one of the questions asking, do we have data for the percentage of BSL-4 labs that have personal reliability measures in place? That is not something that we actually looked into. It would be another good indicator or best practice indicator that could equally also be added to our list, but it's not something that we currently had data on. So maybe something for the next version of this map. Thanks. Over to you, Greg.
So there are several questions about the possibility of covert or hidden BSL-4 labs and how we kind of account for that in our research, and then if there are penalties for countries that don't declare BSL-4 labs. So first off, there is no requirement, binding requirement for any country to declare that they have a BSL-4 lab or not. The only requirement that's out there is a voluntary confidence building measure under the BWC that asks countries to declare whether or not they have maximum containment labs. With one exception, all countries have reported all the labs that we've been able to identify. The only case where we suspect that there is a undeclared BSL-4 lab is a virology research center in Russia at Sergeyev Posad, because it's declared to be a BSL-3 lab, and yet the research they do with Ebola, and especially infection of large animals with Ebola, can really only be safely done under maximum containment conditions, even under Russian biosafety regulations. So that is the one lab that's included in our map and our database that has not been publicly declared as a maximum containment lab by the countries themselves or by the labs themselves. And so it's also worth emphasizing that 99% of the information we have about these labs is from open sources. Most of these labs have their own websites. Countries are declaring BSL-4 labs to the BWC as they are supposed to. So this is a kind of aggregation of a lot of public source information. And so, there is, concerns have been raised about, that this is create, security risks that all these labs are public. The reality is these labs are all, the vast majority of them are already public. They are mostly government run institutions, right? These are large facilities that you can't just, hide in the middle of a city. And so what we're really just trying to do is provide greater awareness about the nature of these labs and the important work that they do, but also the risks that they potentially pose from a safety and security perspective, right? With the goal of strengthening biorisk management in each of these countries and globally as well. And we have found that there's just a lot of kind of misunderstandings, misinformation about maximum containment labs, and we're hoping this helps contribute to a better and broader understanding of what these labs are, where they are, and what they do. So this is done in the spirit of trying to overall improve our that these labs are being operated as safely, securely, and responsibly as possible in order to do the important scientific work that needs to be done to better understand these pathogens and develop new medical countermeasures and diagnostic tests.
Thanks, Greg. Yeah, just to emphasize, all the data in the database is publicly available data that we've collated. So the risk is in collating this information together. And certainly our assessment is that the benefit of collating this information far outweighs the risks of doing so, because exactly what Greg was saying, this is one way we can start to strengthen biosafety, biosecurity, dual use oversight. There was a question here about whether in future we have plans to expand the site to include some of the types of labs, agriculture, BSL-4 glove boxes, labs that can surge, that we have excluded from this study. So on this point, I think when we talked to colleagues earlier about the study, was that they would say, okay, you're mapping the BSL-4 labs, but is that really where the major risks are? And we completely agree. BSL-4 labs are really just the very tip of the iceberg. An obvious next step would be not just to expand to animal facilities, but also to expand to BSL-3 labs. That is a much, much greater endeavor. There are so many BSL-3 labs. There are governments that don't have oversight within their own countries of exactly how many labs are present. Off the top of my head, I know the US, for instance, has over 1,500 of these labs, probably more. And again, there isn't a set state. So there isn't a set official number. And so that is certainly something that we're thinking about and how we would take this work forward. We do acknowledge that this is just a first step when it comes to starting this mapping process. There was a second question I also wanted to address, which asks, do we also have information on the governmental oversight of all labs? Is there legislation in place? And if yes, how is it structured? How about inspections? We've done, this is to a large extent, a kind of a superficial study in that we've not gone into every single country, into the 23 different countries that are part of this study, and looked into the exact national legislation and compared that across and noted whether or not there are active inspections and how those are carried out, how the laws and regulations are actually implemented. I think this is a very important point. The first step is to have national laws and regulations in place related to biosafety and biosecurity, as well as dual use. But the second step is to make sure this gets properly implemented on the ground level. So that would be another type of project that could be spun off this project. But again, it's not something we went into in this project, which is something we didn't say, but it's something we've put together in just a few weeks with great, obviously, assistance from both Joseph and Min. But we felt that it was important to start mapping these kinds of labs. Both Greg and I, over the last year, has had a lot of interaction with journalists who have asked us, so where do we get the official information on where these, on how many labs there are in the world? And we've gotten to the point where we said, well, no, actually there isn't an official count on this, and good good broadsheets, significant newspapers have had to resort to things like Wikipedia in order to get some figures on this. And we both felt that was inappropriate and thought we would try to start addressing this issue. We are aware there are many colleagues who have also tried. This is, as we say, just a first attempt because it is really difficult to decide what to include and what to exclude because there isn't a direct comparison across countries on this. But this is our first go, and we hope to improve it and build on it in future. And we do hope to have and to do so in a constructive way to encourage transparency across the range of countries. And we do hope for your support in this endeavor. Over to you, Greg.
Thanks, Philippa. So there's a question about whether the lack of participation by countries in the International Group of Experts on Biosafety and Biosecurity Regulators is due to the fact that a lot of these countries don't have a national oversight system similar to what the United States has. In the US, we call it the Federal Select Agent Program. And questions furthermore, is there an opportunity to have countries engage in the IGEBBR without those national biorisk programs in place? Well, I think what we would like to see is the IGEBBR, definitely expand its membership and help countries that don't have national biorisk management systems in place develop those. Because it's not enough for a country to just have a single agency or a single lab have its own policies. These types of labs really need support of the whole government system for biosafety and biosecurity oversight and doing this research oversight. So to the extent that that this forum can go beyond sharing best practice amongst its own members to helping build up the capacity of other countries with maximum containment labs to develop national biorisk management systems, I think that'd be a great use of that group and would be a great resource for countries that are either new to the BSL-4 business or looking to to expand their labs and their work in that arena.
We should point out, Greg, what IEGBBR stands for. It is the International Experts Group of Biosafety and Biosecurity Regulators. So it's an international group of expert regulators. And it's, again, one of these indicators that we've used, whether or not countries are members of that group. So obviously regulators have an important role to play in this. I'll have a go at one quick question before I ping back to you. Greg, there's a question about whether we're planning to add information about gain of function research within the labs. Gain of function, of course, is something that has been very heavily in the news over the last weeks and months. From our perspective, gain of function is just one type of high risk, potentially high risk research. There are many different kinds of potentially high risk research when we're thinking about dual use or thinking about repurposing potential. From our perspective, looking just at gain of function, whether or not a lab is carrying out gain of function doesn't tell you so much. I think certainly when gain of function is carried out at biosafety level 4 institutes with or labs with high risk pathogens, that could be of concern, but it depends exactly what the sort of thing that's being done. But our perspective would be it needs to go broader beyond just singling out gain of function research. It needs to be looking at, you need to identify high risk research more generally for repurposing potential. Greg?
There are a lot of really good questions in the Q&A that I'm afraid we're not going to have time to get to all of them. So if we don't get to it, we apologize, but feel free to send an email to the Global Biolabs Project at gmail.com address that is on the presentation and on the globalbiolabs.org website, and we'll try and get back to you if we can. There was a question here about whether there's a central repository of reported BSL-4 lab accidents or incidents, and is there any reporting requirement that could be inserted into the BWC treaty, and what standards are there for evaluating BSL-4 lab biosafety and biosecurity on a routine basis. Right now, there is no central repository for information about any kind of laboratory accidents. That data is collected at the national level, and different nations have different reporting standards. different levels of implementation and enforcement. So it's a very patchy system at this point. Those reporting systems that deal with laboratory accidents in general, they're not specific to BSL-4 labs. So there's a definite kind of lack of consistency across countries and a lack of aggregation at international level. But there has been some good research where people try to collect that national data to come up with estimates about lab accidents and their causes and how to prevent them. And again, that's an area where it would really be great to see the BSL-4 labs working together, develop such standards, or working with that group we mentioned earlier, the international group of experts on biosafety and biosecurity regulators, and be able to come up with an international standard that all countries could adopt and make that kind of reporting much more consistent, transparent, and that would be a big help, I think, to reducing the risk of biosafety accidents.
So we've got about 43 open questions at the moment, so we're just going to keep firing through these. Thank you so much for submitting all of these. This is fantastic. Quick question: are there not WHO biosafety lab regulations? There's certainly WHO guidance. None of that is mandatory. How did you distinguish DIRC regulations, so dual use research of concern regulations, from standard biosafety and biosecurity regulations? It's really about that dual use. It's about that repurposing potential. So we looked at countries that had national policies on dual use research of concern. So not necessarily using that phrase, dual use research of concern, but national policies on risk assessments for repurposing potential. That we are conscious that there are countries that will have publishers, for instance, that ask authors to consider that the dual use research of concern potential when submitting manuscripts. We are conscious that there are funders who ask their research proposers or researchers who submit proposals to consider that aspect. We didn't include those. Those are not national policies. So at the moment, as you saw, there are only 3 countries that we've identified that have BSL-4 labs and that have these national policies in place. Finally, there was a question. Sorry, it jumps a little bit here about yes, if we were going to include mobile labs in future. Yes, potentially mobile labs would be another indicator of another way we could take this project. There are some, there's not a huge amount of BSL-4 labs that are in mobile facilities, but there are some, and they could certainly be included in future. Yeah, over to you, Greg.
There's a question about the degree to which there are international collaborations among BSL-4 labs. And there is a network in Europe among biosafety level 4 labs. There's also an international network of labs that work on zoonotic diseases, the BSL-4 ZNet network that was established by Canada. And then there's also a kind of informal group of directors of some maximum containment labs that work together. But these networks are kind of valuable, but they are rather limited, and they have a very broad focus. What we would like to see is more kind of focused collaboration, information sharing, best practice sharing on biosafety, biosecurity, and dual use research oversight. And it's worth noting that some labs have adopted their own policies with these regards, going beyond what are in the requirements of their by their country and by legislation. So some labs have been very proactive on this. But again, we also see the value of having these labs operations be embedded in a national biorisk management system that will cover not just BSL-4 labs, but other high containment labs that also work with pathogens that pose safety and security risks. So even though kind of BSL-4 is the focus of this presentation, a lot of our policy recommendations really apply broadly to the entire high and maximum containment biosafety enterprise.
Important question here, asking about which agency commissioned our study. It was a university-funded project coming out of King's College London. All funds were provided through the through the university and through UK Research Council money. So this is not this is not a specifically funded project. It's a project that Greg and I have come up with ourselves and sought funding from our institutions. There was a second question here about there was an offer of assistance to deal with animal labs. Thank you very much, very appreciated. We will certainly be taking people up on those kinds of things in future. Please do step forward to help with this project. And final question from me before I kick over to you, Greg. Most accidental releases, according to published reports, are a result of human error. Could we please speak about personal training, accreditation, and personal reliability? All very important aspects, I think. I mean, the law in the books, regulations, guidance is only as good as it translates into human behavior. So I think here is a really important role, a really important point about the need to focus on what actually happens on the ground in labs and on human behavior. And I'm going to emphasize that point, being a social scientist, a sociologist with a focus on people. I think there's a much bigger role here to play for social scientists studying science in action. Greg.
There are a couple of questions about future trends in maximum containment lab construction, especially in the post-COVID era. And it's worth noting a couple of things. I mean, number one, there has definitely been a tendency for major biological threats to trigger the building of more maximum containment labs. So we saw a large increase in such labs in the 2000s following the anthrax letter attacks in 2001 and the SARS outbreak in 2002, 2003. Likewise, there were several announcements made after the 2014 Ebola outbreak about labs being planned in response to that. And the other thing to note is that these labs, especially the larger labs, can take upwards of a decade to build and come into operation. So we shouldn't expect to see a lot of BSL-4 labs popping up, tomorrow. But the events that were going on with the pandemic now and the types of research that people are increasingly focusing on means that we're going to see more of these labs in 10 years or so. So again, that's why it's important to understand the trajectory and the trends in lab construction, and that's part of what we try to do in terms of mapping this out and providing dates for labs that we know became operational, and also looking at the policies that we have and trying to gauge whether the policies we have now are adequate, given the increasing scope and number and sophistication of these labs, and anticipating further such labs being built in the near future. And really, what we'd like to do is start a dialogue about how do you make sure that the biorisk management policies and practices at both the lab level, the national level, the international level are keeping up with the scope and type of work that's being conducted in these types of facilities. So we hope this presentation has helped advance that dialogue in some way.
And there's certainly been a question around also, has the current pandemic kind of given a boost to these kinds of labs? Or are we going to see yet another increase in these sorts of facilities coming out of the pandemic? Well, we don't know at this point from our research. We've not seen that, but it does take some time to agree to fund this kind of lab and then establish it and construct it. So we may well, what we have seen are, of course, many more people working with coronaviruses. So there certainly has been a proliferation of risk in that sense. There's also questions around what sort of international structures, oversight structures, we would imagine. There's a question, do we need an agency like the IAEA, but for pathogen research? The IAEA, of course, is the nuclear safeguarding organization, or for instance, the OPCW, the Organization for Prohibition of Chemical Weapons, which has inspectors that go into places. Do we need that for pathogens? I think that is not exactly the sort of institution that we would imagine, but we do, and I don't think we really have the institution already that we can just tag this kind of work onto, but it is certainly time to do some serious rethinking about the sorts of international structures that would need to be in place to have this kind of oversight. There are examples that can be drawn on, and there are examples of established structures in place. There are examples of inspections, investigations, visits, regulatory engagement that can be drawn on. But I think this requires, it shouldn't be a fully formed idea at this point. It requires input from a lot of different stakeholders. Greg, over to you.
Well, I think we've hit our allotted time, and even though we still have a number of questions still on the docket, I would encourage folks to send an email to our project website with either ideas for future things we could do, or if there are any kind of glitches with the map or other data sources you want to point us to, we're definitely open to that. And if you have questions about how we did the study or other issues, we'd be happy to take a look at those and try and get back to you. So I just want to say we hope this does become a source of information for the public, for the media, for governments, and for the labs themselves, in order to have more transparency and better understanding about the nature of the maximum biocontainment lab enterprise and the biorisk management practices that go along with them. So with that, let me turn things over to Philippa to close things out.
Well, thank you, Greg. Thank you to all of you for an incredible amount of engagement, questions, encouragement. We do appreciate it. We will take note of all your questions and think thoroughly about how we best take this endeavor forward. So you know where to find us. There is an email on the website. The site should now be open. So go have a look around yourself. And as Greg said, do get in touch with amendments and updates. So that's all from us. Thank you very much for your time today. Goodbye.
Goodbye, everybody. Thanks for joining us.